Hello and good morning. My name is Jeffrey Fillingham, and I am presenting on a topic titled How to Position a Patient Correctly for a PA and Lateral Chest Radiographic Examination. This presentation will be a step-by-step process of safely positioning and imaging of the chest. Well, the first step anytime we're doing a radiographic examination is to absolutely undoubtedly correctly identify the patient whose order corresponds to things like the accession number or medical records number, correlating that to the date of birth or the financial or FIN number. Really, it just depends. Each facility has varying identifiers for this step. It's usually a two-step process. And it's your job as the radiographer to understand what each facility prefers and or requires. The next step, which is step number 2, is for the radiographer to get a brief but thorough history of the patient's complaints and their signs and or symptoms. It's important for us to help the radiologist understand where the patient's pain might be or how long they've been suffering for a specific sign and or symptom. An example might include having a wet productive cough for 2 weeks with no history of thoracic surgery. On this slide, you can see clearly a picture of the right and left lung animation illustration. I've also included a short 3-minute YouTube video hyperlink so that other users can click on that and actually see a short video on positioning. The next step is step number 3, which is to explain the procedure to the patient to help ease any anxiety and to also help instruct the patient on what to expect. There are certain examinations, for instance, that require only 2 radiographs or exposures to be taken, whereas there are others that might take anywhere from 4 to 6 to possibly even 8 or more images. So to help alleviate any anxiety, let that patient know what to expect. And then the next step is number 4, which is to actually position the patient for the actual specific projection, whether that be a PA post-anterior projection or an AP anterior-posterior projection. The radiographer must be aware of ideal versus complicated situations for the patient. This may affect how the radiographer positions for the routine series. For instance, the patient may be unable to stand for the required projections, and this plays a role in whether the radiographer will have to order a portable examination and actually come to the patient's room, or a decubitus examination, which really is to visualize any possible air fluid levels, which could indicate a particular pathology.